Injection of Sunmax collagen. Diagnosis before surgery for dark eye circles and tear trough areas. Formation of dark eye circles is primarily due to poor blood circulation around the eyes, so slowly pigmentation would result, and some fine lines would also appear around the eyes. And certainly, allergies and staying up late would also cause dark eye circles to appear. This customer has simultaneously the two concerns of tear trough and pigmentation, so we call this a hybrid dark eye circles. The two main reasons for the formation of tear trough are, first, the eye bag is relatively more protruding, so the distance between orbital bone and eye bag becomes relatively larger. And second, there is the so-called sagging of apple cheeks, which would cause a hollowness between apple cheeks and orbital bones. This area is the dark eye circles. For our injection's needle entry point, we would choose the point at the borderline between tail and inner corner of the eye, and at the borderline along the sunken area around the eye. It's the same for both sides. Simultaneously, we can cure the tear trough and the pigmentation of the dark eye circles. We are using 27G cannula. We begin to inject from the needle entry point on one side. Perform retrograde dotted fan-shaped injection towards internal canthus. Depth for injection over tear trough, which is below orbicularis oculi muscle and above periosteum. Intensive injections shall be made between dots before pressing them down. It'd be easier to adjust the dosage this way. Gradually, allow the whole area to be filled up. Dosage over the tear trough is approximately 0.5 to 0.8 milliliters. However, you have to be cautious not to get too close to the internal canthus. At least a 3 to 5 millimeter of gap needs to be reserved, as there are countless blood vessels over here. After injections over tear trough are complete, we make the needle head slightly more shallow for injection over the dark eye circles. Depth for injection over dark eye circles is below superficial muscle and below epidermis. Both locations need a bit of dotted injections. It's the same for the other side. From the needle entry point, move towards internal canthus and perform retrograde dotted fan-shaped injection. But the skin here is extremely thin. Therefore, some doctors would use normal saline to dilute collagen in 1:1 ratio for the injection. In order to prevent the skin from becoming uneven or specially protruding or retracted. However, if you are confident with your skill over dosage control and believe that you can make it really smooth and stable, then you don't have to perform the dilution. Personally, I don't make the dilution and make the injection dot by dot. Dosage is approximately 0.1 to 0.2 milliliters. But injection shall not be too close to internal canthus. Similar to tear trough injection, we have to slowly pave over the whole area. Let's look at the results after the injection. Pigmentation of dark eye circles would immediately fade out. As time goes by and with the growth of collagen, our blood circulation will be improved, and more of this pigmentation will be removed. And the results would become even more apparent after 3 to 4 weeks. After the hollowness over the tear trough is filled up, eyes would not look so tired anymore. We can immediately notice the results.